Hello and welcome to a very special program. I'm in the control room of the National Center for Disease Control. This is the center which is very much at the forefront of the fight in India against the spread of the COVID-19 virus, the coronavirus as it was. And all of these individuals around me, there are more than 30 of them, are working through the day and through the night on shifts to take phone calls from individuals, not just in India, but across the world, asking basic questions. Questions like, I have a headache, should I be tested for COVID-19? I'm not feeling well, where should I go? And the questions which these individuals ask those who are calling is, do you have a travel history to one of these countries where there are a lot of infections? Do you have a contact with anybody who's been contracted with COVID-19? And based on the answers from wherever they may call, they are then given advice. Yes, you need to go to a center where you are tested, or no, you don't need to go right now. But the numbers that these individuals are taking care of are truly staggering. Up till 8 a.m. this morning, there were 25,730 calls and there were 23,076 emails which were received. These numbers will be updated when each of the records of these individuals is tabulated. On this program, we speak to the director of this institute and also the senior microbiologist, somebody who is in charge of overseeing the process of the testing of the samples as they're brought in. Over here, more than 1,000 samples have come in to this center. As the world continues to fight the COVID-19 disease, we wanted to get an idea of preparedness inside India to meet some of those individuals who are really leading the fight in taking a look at those samples. We are inside the National Center for Disease Control and I'm joined by Dr. Sujit Singh. Thank you, sir, very much for being with us. He's the director of this facility. For starters, sir, this door behind me, it leads to the labs where the actual sample tests are taking place. Is that right?
Yes, that's correct. And that's a biosecurity level, so that's why we have to go for a strict entry, and then after sterilization only a person can enter.
And tell us a little bit more about that process itself. You were telling me that there are air showers in this room behind me, and that this actually leads to another room, and then finally entry to the labs takes place. How is safety of the people who work here one of your primary concerns?
No, I think the safety of the healthcare worker is of the prime importance, because in China itself, you see that around 4,000 healthcare workers have been affected. So first and foremost thing is the protection or the safety of our healthcare workers. And if you see this particular shower or this whole arrangement is just because to ensure that our persons don't enter into the lab area without proper PPE, without personal protective gears, which have adequate precautions. So that is why first air shower, then changing room, then donning and doffing room, all these things are lined up in queue. And before one person enters into a biosafety level cabinet and starts working, he has to go through a number of procedures.
And to be sure, we are nowhere close to that facility standing.
No, not at all. We're just outside that, right, in the main corridor itself.
Right. But at this facility in Delhi, you have tested 1,000 odd samples so far?
Yes, I think more than 1,000 odd samples we have tested, and she's our microbiologist heading the lab.
Why don't you come here, ma'am?
She is the one who is leading the fight in the laboratory testing procedures.
Right. So, and can you tell us some of the challenges which you face in this entire testing procedure? How long, for example, does it take?
It is a 5 hours procedure because there are 4 steps involved in it. That is, firstly, when the sample comes, this is received at our ground floor, and then we are collecting all the samples and taking them to the laboratory. Over there, first the sample decontamination is done, that is the virus inactivation. So that, and people, they wear the personal protective equipment when they are dealing with these things so that they don't get exposed to the infection. And then after that, once the virus inactivation is done, then the RNA extraction is done from this COVID-19 virus. And after RNA extraction, then the procedure is not that hazardous for the healthcare workers. And then they go to the other laboratory where they process the sample and they start doing the PCR.
Right. And that's when you get
so in total, it takes around 5 hours.
Right.
And then after that, the reporting is done for all the cases.
And Dr. Singh, once you get a result, positive or negative, you instantaneously update the system. which is what you've set up here as well.
No, I think that also requires little bit vetting by the senior microbiologist, and once everybody is in consensus with regard to the results, because there are various procedures as she has highlighted. So all these things need to be carefully examined before one declares the result in public.
Kamsa, if we can just walk over here and just take and walk through these facilities. You also have a system where you are interacting constantly with healthcare professionals across the country for real-time monitoring of the situation. Can you tell us a little bit about that?
No, I think that is the integrated disease surveillance network which we have across all the 700 plus districts in the country. So that is the system which is tracking the community, particularly the travelers who have not been able to be detected at our points of entry, that is airports, ports and this. So when they go into the community, they are in the incubation phase. There is always a likelihood that within next 14 days, anytime within next 14 days, they may develop some symptoms. And that is the time when they are required to be hospitalized and the sample needs to be tested.
Yeah. And ma'am, as a senior microbiologist yourself, when did it strike you that the situation you were dealing with now was progressively getting worse, not just in India but around the world, that you were dealing with one of the most difficult medical situations any country, anywhere in the world has faced? When did that dawn to you and your workers that you are very much at the edge of a war and you are fighting it as a doctor yourself?
Actually, when it initiated in January, so we are updated with the daily status, and we knew it that the cases, they are increasing not only in China, and then it has started spreading to the other countries, and we have to, as per Government of India guidelines, we started preparedness for the testing, so that whenever we start receiving the samples, we are ready, so that people, the patients, those who want to get the report, they can get the timely report. So we were, because this institution, NCDC, is always dealing with many outbreaks whenever it is there. So they always start getting prepared in the very beginning whenever something like this is there.
Yeah. And this center would have some of the finest experts in this field dealing with all of these diseases and ailments. Tell us a little bit about the very, very skilled doctors, biologists, microbiologists and others who work over here.
Actually, this particular institute is unique in itself. It has got over 10 divisions, right from microbiology to pathology, what you call Department of Parasitic Diseases, epidemiology, which is doing really epidemiological intelligence in this particular work. And this is, as you have already said, one of the most complex pandemics which the world has ever faced. So looking at the complexity, looking at the quarantine facility management, evacuation of the travelers from various countries, it's really challenging. And she has not elaborated the challenges which we are facing with the day-to-day samples which are coming. We are flooded with the samples of the asymptomatic persons. Everybody who comes in contact with a positive person, whether he has got the symptoms or not got the symptoms, he wants his sample to be tested, which is a really misnomer. Because on the very first day of the contact, if you set his sample, there is all possibility that it will come negative, because virus load building takes time. So once the virus load is built up, then only you will get the sample tested, and it will get a false sense of well-being also. If you test the sample on the first day, get it negative, you are very well overconfident rather that now I am free, but that's not the case. So that is what I want to highlight here, that persons should be more particular, that when doctor advises them, that should be the time when the sample should be sent.
Yeah. Would you like to add to that a number of cases coming in because people are worried, there's a sense of panic, when in fact they should be waiting perhaps for a while? That's an interesting point. Would you like to add to that?
Yeah, that is why that Government of India and our institutions also, they keep on they keep on updating the guidelines, and they have recommended that only the symptomatic cases, those who are having the history of travel to the high-risk countries, not to all the countries, mainly to the high-risk countries, so that the whatever sample load we get, it is manageable, because there is a network of around 53 laboratories in the country which can do the testing. But when if asymptomatic, like Sir also mentioned, if asymptomatic start they coming, then the sample load really increases a lot. And then the symptomatic, those who are having history of contact with lab confirmed positive cases, only these are the two categories of people, those which are recommended that the sample should be taken from them.
Sure. Just one or two more questions. We've now moved to the next phase in terms of being alert in this country. Visas are not being issued. Even Indian nationals could be quarantined upon arrival in India. And there are new guidelines, new laws which have been enacted. They're old laws, but they have been put into effect. What powers does this give the central government and the state government to deal with a situation like this?
I think I'd like to highlight one important phase. If you look at the world, look at the Europe, look at the China, look at the most developed countries in the world like US, UK and all, everybody is fighting and everybody is having more number of cases than what India is having right now.
Yeah.
So that is the time. If we are really not particular at this moment, then definitely we may miss the bus.
Right.
So that is why our government has been proactive, and most of the ministries have come together. This is, I think, a unique example where Ministry of Defense, Home Affairs, External Affairs, everybody is coming together to this particular important cause. And this particular move which the government has taken, I think it's really a move which should be appreciated by one and all.
Yeah.
So because this gives us time, that once we are done with the foreigners which are incoming and bringing infection to our country, then we'll be able to focus on our own citizens who are there in the country.
And that was my next question to you, contact surveillance. Where one person has come in contact with their family's friends, the numbers are very large. That means that healthcare officials would need to be large also to actually find these cases. How much of a challenge is that?
That's a great challenge, but yes,
is that the greatest challenge, Doctor?
I don't say that it's the greatest. Actually, every field is a challenge. Once you get the case,
testing
itself is a challenge. Dealing with the community is a challenge. Once you get a cluster, you have to contain that cluster into that particular location, see that the infection doesn't spread far. So that's putting all symptomatic into the hospitals. Everything is a challenge, and then managing the case where you don't have any treatment, where you don't have any vaccine. I think there are many challenges on all fronts.
But we've not moved to community transmission as yet.
Right now, no. There is no community transmission, although there is a focal and local transmission. That's bound because all are travel-related cases which have occurred. And from travel-related, we have got some contacts who have also turned out to be positive.
Right. And ma'am, one final question to you. Everybody wants to know, where's the cure? Where's the cure? We read about what some countries may be doing, but then there is a process of testing which has to happen. There have to be, but we are fighting against time over here. So if somebody was to ask you, where is the cure? Will there be a cure? What would your answer be?
Actually, this is a self-resolving disease, like because other viral infections like H1N1 outbreak, it was there. These are all self-resolving. And main thing is, depending upon the symptomatology, supportive care has to be given so that there is no further worsening of the patient condition. That is the only treatment. And vaccine, whenever this kind of new outbreak is there, then the vaccine development, it also starts. And it takes around 1 year minimum to develop a vaccine. So once the vaccine is available, then we can prevent the infection.
Right.
For cure, it is a self-resolving disease. That is why it gets cured on its own.
Sure. Yes. All right. Well, I'd like to thank both of you very much for joining us. Well, there you have it. A look at some of the key testers leading the fight against the COVID-19 illness in this facility, one of the primary facilities in the country where these samples are being brought in to see if people are infected with the disease or not. As we look at all the COVID-19 cases across India and indeed around the world, it's important to remember that the rate of patients getting better in some countries is actually improving. If you look at the situation in China, the number of recoveries have been fairly significant, which is why it's also important to look at and talk to individuals who've had the illness and who are better now. My colleague Sneha Mary Koshi did just that.
You have been in isolation for around a month. First at home, then hospital, then again at home you were in quarantine. So almost a month of isolation and quarantine. How difficult was it for you during that period, and what kind of help and support did you get?
My isolation days were going on because I admitted to isolation on 27th Jan because I had slight sore throat, and they shifted me to General Hospital. By 28th itself, my symptoms and all was over. I was asymptomatic that time itself. So my health condition was normal. By 30th only my result came. So at that time they shifted me to medical college. Then they started treatment for they gave me antiviral drugs for 5 days. After that I didn't have any medicine at all.
The Delhi government has now taken the important step of preventing people from going to cinema halls till the 31st of this March and also shutting schools. But the big question is this: what are some of the new rules which have been invoked by the government? How do they work? How do they in effect replace rules which could exist in various states to ensure that the centre has the power to ensure that the COVID-19 outbreak doesn't get any worse? We have this special report.
All cinema halls, all schools except those classes taking exams have been closed in India's capital.
सभी सिनेमा हॉल्स 31 मार्च तक के लिए बंद किए जा रहे हैं। सभी स्कूल्स और कॉलेजेस जहां पे एग्ज़ाम्स नहीं है, जो एग्ज़ाम्स हैं बस वो चलते रहेंगे। बाकी सभी स्कूल्स और कॉलेजेस 31 मार्च तक के लिए बंद कर दिए जाएंगे। सभी पब्लिक प्लेसेस जितने हैं, जैसे जितने सरकारी दफ्तर हैं, जितने प्राइवेट दफ्तर हैं, जितने मॉल्स हैं, शॉप्स हैं, सभी के लिए ये कंपलसरी किया जा रहा है कि डेली आप अपने अपने पब्लिक प्लेस को डिसइंफेक्ट करेंगे।
The central government, now armed with special powers to override states on matters of health, says the biggest challenge is to slow the spread by tracking down each contact of those infected. For instance, 73 patients so far led to hundreds of contacts, of which over 1,000 are now being monitored. But officials say steps like the partial ban on visas will help, and so far they think they have not missed any case.
We have done our risk assessment, and based on that we understand that we have to be prepared in terms of managing the situation. It is not that India itself has taken these steps. There are other countries based on their own risk assessment, they have taken their steps, and there are cases where the whole countries have been kept in lockdown also. We have only sort of managed in terms of point of entry cases right now.
Cinema halls like this one will remain shut from tomorrow till 31st March because of the Delhi government's order. While there has been speculation that hotter temperatures will reduce the spread of coronavirus, today the Health Ministry clarified, saying that there is no confirmed study so far to make that claim. In New Delhi with camera person Mursalin Mohammed, this is Sukirti Dwivedi for NDTV.
Social distancing, whereby people actually keep a physical distance away from those who are unwell or who have symptoms of COVID-19 or even the common cold, is one of the important steps to ensure that the disease doesn't spread very much further. But this also means that you're not supposed to be getting together in large numbers in any places, not even perhaps in religious institutions, not even in cricket matches, which raises some important questions. What about the IPL tournament coming up? What about the matches being played against South Africa? Important questions, but at a time like this, when public health and safety is all important and an all pervasive concern, these are questions that need to be looked at very closely indeed.
The world's richest temple at Tirupati in Andhra Pradesh has asked devotees coming from abroad to wait at least 28 days from the day they land before visiting the temple. With most cases in India directly linked to passengers from abroad, the shrine is being extra safe. To prevent the spread of coronavirus, there is no bar on domestic pilgrims. Sabrimala in Kerala will be opening for 6 days, but the Chief Minister has appealed to devotees to avoid it for now. So far, it is largely business as usual at the beautiful Golden Temple, with bio-attendants for employees stocked.
ਗੁਰੂ ਰਾਮਦਾਸ ਹਸਪੀਟਲ ਦੇ ਵਿੱਚ ਇੱਕ ਵੱਖਰੀ ਵਾਰਡ ਸਥਾਪਿਤ ਕੀਤੀ ਮਰੀਜ਼ਾਂ ਵਾਸਤੇ ਔਰ ICCU ਜਿਹੜਾ ਆ ਉਹ ਵੱਖਰਾ ਤਿਆਰ ਕੀਤਾ ਗਿਆ। ਉਹਦੇ ਵਿੱਚ ਮੁਲਾਜ਼ਮਾਂ ਦੀ ਜਿਹੜੀ ਬਾਇਓਮੈਟ੍ਰਿਕ ਹਾਜ਼ਰੀ ਲੱਗਦੀ ਸੀ ਉਹਨੂੰ ਬੰਦ ਕੀਤਾ ਗਿਆ।
In Kerala, some churches have cancelled their retreats and conventions until the end of the month. With the Lent season on, churches in Bengaluru are not seeing large congregations, but the matter is being considered by church authorities. In Bengaluru, the international headquarters of the Art of Living, which attracts thousands of foreign visitors, has been closed until the 25th of March. It may take a lot to change ingrained habits, but with some shrines echoing the government appeals to stay away from crowds for the time being, it could prove to be very useful to slow down the spread of coronavirus. With Bureau Inputs, Maya Sharma for NDTV.